Hi and welcome. This is Vicki Draper
Ariel, Hubbard.
and we are here for the Pets and People Healing for Pets and People, and we're going to do a surgery edition. So I'd like to say this is the month of love. It's February, and this is about loving your and your pet's bodies and doing good care pre and post surgery, energetically, in addition to what you do with your medical doctors and veterinarians' advices. So, Ariel, would you like to share why this is important?
Absolutely. So, surgery as a treatment definitely has a place in medical care. A lot of times in allopathic medicine, that is a go-to, and they have over time asked people to do other things before they do that as an intervention. But it does have its place, especially if we need hip and knee replacements, or we need like an organ healing, like on a significant level, like a heart transplant or something like that. So it definitely has its place. A lot of people are afraid of surgery, and you don't have to be afraid. You just need to do your due diligence and do your research. And when you do surgery, there are energetic repercussions as well as physical ones. In this show, we're going to talk about some of the energy repercussions. We're going to talk about some of the physical stuff too. So, Vicki, you have a story about that, right? You have a story about a dog that was getting a local surgery. Am I right?
Oh, yes. Well, we're talking about the energetics, and I had a client, this was years ago, that was coming weekly and it was in person. And so it was for wellness. And so I knew this dog, and every week, what had transpired. So Zena was the dog's name. Zena came in, and I'm like, what happened? Her whole low back is stiff, and it was just not her normal. And she says, oh, well, she had a local and had a little bump removed. And it was like, oh my gosh, if a local does this, just know what then surgery does to the energy and the body. That it's not a bad thing because we need it, but then it's knowing then how to support it. So anyway, so we got Xena all back and balanced, but I
Mm.
was really, really shocked that just a local could impact the energy field that much.
It depends, like, right, on the type of surgery too. In some cases, when surgeons on people, they're working on people, they might do incisions and it doesn't necessarily affect the energy field as much or the flow of the meridians, but sometimes it really does. So in traditional Oriental or Asian medicine, they talk about trying to avoid removing organs unless it's absolutely necessary, because the organs are responsible for part of the energy flow in the body. And there are organ times, and there are 2-hour time periods where energies tend to focus in an organ. And so sometimes when people have had organs removed, I've done energetic organ rebuilds so that they could actually have an energetic organ, so that their rhythm, the energy rhythm, could be the same. And that was important. It's called the circadian clock, and it's important to have the energy flow through in the 2-hour increments through different organs. So there are things that can be done. Energy work does accelerate healing post surgery. So again, you don't have to be afraid of it. If you need to get it, you don't need to be afraid. You just need to do the preparation before and after. So when do you need surgery? Do you? I have examples. Do you have examples, Vicki? When your animals need surgery, can you tell that they need something, or do the vets just notice it?
The vets, usually it's the vets are
Yeah.
recommending it.
Yeah.
And well, a big one is like a torn ACL. If it's slightly torn or really severely torn, yes, you need the ACL surgery. If it's slightly, do you not? Lots of factors.
Right. Because animals have ACLs too, guys, not just people. Because they're mammals, like we
So
are.
that's a
So
big one that
yeah.
I get the contra. People come to me going, can we prevent surgery or prepare for the surgery? Yeah.
And then what kind of results do you get when you try to do preventative care with them?
Oh, they it gives them natural pain relieving, and it
Yep.
also then is strengthening their body and their legs, and so they get more use out of it and better quality of feeling with it. And so
Right. And
some people that
sometimes
elect not to have surgery, we can support their dog with, with the alternative
Energy work.
care, energy
Yeah,
work, and help them live quality of life. And like I
that's
said,
huge.
and that's also the extent of the tear. Um, but yeah, that's one way I support people, whether they have the surgery or not, is helping their animal get the natural benefits and their body's natural healing benefits and let them thrive.
Right. So Vicky and I have a lot of experience, decades of experience. So a lot of times we can see what's going on with an animal or a person. So a lot of times, I can tell if someone's going to need a surgery ahead of time, especially if it's like a joint replacement situation by their gait. So I am also a massage therapist, so we do gait analysis, and Vicky is too, actually. And we can see how people or animals are walking, and we can see whether something's off with their gait. And there are certain types of gaits that indicate that there is a need for a joint replacement. And I told people like they were in a lot of pain. And I said, you need to go get looked at in case you need a hip replacement, because I think you do. And it wasn't diagnosis, it wasn't a prescription, it was a referral to an orthopedic surgeon. And this particular woman was like 34. And she said, you changed my life, because if I hadn't listened to you, I never would have known that I needed that surgery. Because she went to the doctor, she needed the surgery, she got the surgery, and her whole life was better because of that. Most people don't get hip replacements or knee replacements until they're older, usually like their 60s or older, sometimes 50s. Occasionally, you're going to get that person who needs it in their 30s. The other thing about joint replacements is the technology is changing a lot. And it used to be 10 years, then it was 15, then it was 20, now it's around 20 that they can get it done. So sometimes people try to put off surgery as long as they can, to make that joint replacement last longer, so they don't have to get it as many times or ever again. And so that's where we come in, because we help people or animals put off the need for surgery by managing their symptoms. I've done it with stenosis, I've done it with hips and knees, and Vicky, you've done it with your animals too, right?
Mhm. Yes,
Yes.
yes, yes. And I actually just have a client that has made it through, and we're back to maintenance sessions. She's a regular, but her dog had what the official word, subluxation in the patella, to the
Ow, that
back
sounds.
left knee, and it had been there since birth, but in
Ooh,
Roxy, I guess was now like 8 years old, and it had been bugging her enough, or then it's like she'd
favoring one
been
side.
favoring one
Yeah,
side,
yeah.
so more muscle built up on the other leg, and it had gotten to where, it's like, okay, surgery, is going to be the best way to give her, because she still had a lot of life. She's a small dog, so has a lot of life in her. And what they did actually with her is the other knee, and a lot of times when a dog has a knee issue, the other leg or other knee starts giving out because it's taking more of the weight. And so what they did for her is they ended up doing both legs at the same time.
Wow.
I know, which I was like, really? But then as we, went through and I checked with Roxy, and so what happened is, so then the pre-work was getting her body ready, making sure all the energy is flowing, making sure the muscles are all in good shape so that, the surgery can go well. And then also the bonus of the pre-surgery is I communicated with Roxy what was going to happen, because that was
Right.
a big shock to wake up and couldn't walk, you know. And so I'd let her know it was going to be temporary, and so she navigated that really well. Then I was on the post-surgery side. She was doing the regular vet post-surgery stuff along with my work, supporting her with the energetics and the massage. And now she's back and, using both legs equally and, running around and recovered nicely.
That's awesome. So how could people reach you if they needed help with this?
Oh, healingyouranimal.com. On there I offer a free assessment. You can scroll down on the homepage,
Mhm.
or yeah, it also has my phone and email on there. The best way is sign up for the free assessment and, get right in and we'll talk.
Awesome. So I'm at arielhubbard.com, and I also do pre and post surgical work. So what my experience is, if we communicate with the client's cells and let them know, like sometimes like people take out some tissue and then they're going to put it somewhere else, like that. They're doing this with knees and stuff right now. And I'm not talking about uh, um, PRP treatments. I'm talking about a different type of treatment where they're taking tendons in other parts of the body, and then they're inserting them into the knees, and then the tendon. So some of the tissue that's in tendons is also in ligaments, but there's more elastin in tendons than in ligaments. So I'm asking the cells to change their structure, and um, I'm asking the collagen cells to reproduce more quickly, so that that tissue now becomes more stable and hard. It has a harder tensile strength, so it acts more like a ligament than a tendon. I'm also do it when organs are being removed. Sometimes we'll do like a process of thanking the organ for all of its hard work and releasing it to divine energies, and then letting the body know that the organ's not going to be there anymore. And then if it needs an energetic organ, I'll be rebuilding that after the surgery. And then after the surgery, I check the different layers of the field. I'll check the chakras, the meridians, to make sure that they are um, not damaged or cut or blown out or destroyed, and then rebuilding anything that's necessary. And then I also do lymphatic massage work, because people have swelling after surgery, and especially people get cosmetic surgery. It's an extensive protocol. It's usually between 8 and 20 sessions, and people don't know this. A lot of times when they're going to get in, and they want a nip and tuck, or they want a lipo 360, or they want a breast augmentation, they don't realize that they really need to book all of their lymphatic treatments ahead of time to recover, because it's going to make a difference in how they feel for the rest of their lives. So it's a big deal. And there are a lot of things doctors unfortunately don't tell their patients before their surgery. Usually it involves recovery time and all the things you have to do, like the kind of treatments we do, to help people recover from it. So I just taught a class, a post-treatment lymphatic massage class. So for anybody who's listening and you want to learn how to do this, I can help you with that. Vicki, you also teach all kinds of classes.
I do. I
Yes.
do. My next one is animal communication. So
And
it's,
and you also teach animal Reiki, so that people, not like the guardians, could also Reiki their animals post surgery,
I do.
right?
I
Yep.
do.
Yep.
And I lost my train of thought. I had a great one. Oh, it was with Roxy. Oh, that's what it was. There was a benefit because after the surgery, they gave him a video of some stretches to be doing with Roxy, and they gave the written handout where they didn't match what they were trying to
Oh my
walk me
gosh.
through. So my client was like, I don't know what to do. So I was like, oh, here's what they're telling you. And so I showed her what to
Uh-huh.
do. And so she was so relieved and thankful, because I was like, no wonder it was confusing, because even to me who knows the language and knows what they're talking about, there was a discrepancy between the order in the video they gave them and the handwritten handout. So, anyway, sometimes you need the the help in deciphering the homework.
You need the help of a professional who works in the business to help people and animals recover.
Yes, yes. And I have a cat client who recently had an anal gland removed. And we were doing work beforehand to prep, you know, Lovey's, the kitty's name, Lovey's body to be able to, be in its best shape for the surgery. And then we had a session. I always recommend, within a day or two to have a session post surgery, because it helps just detox the anesthesia and just get the
Mhm,
body balanced. And we happened to do it the day of her surgery. So she was still at the vet in the recovery phase.
mhm.
And so worked with Lovey, connected, and got her out of the fog of, because sometimes when they send the animals home, they're awake, but they're still a little loopy and lethargic. And so working with Lovey, here's what I got back. Lovey is back home and doing very well. She was very energetic when she came home. She
Wow.
literally sprang out of her carrier the second I opened the door. She has been
Right.
very snuggly and bright-eyed. So
She sprang out. Wow.
yeah, and so that's because of the post-surgery work that happened.
Wow.
Um, yeah, so we got, so for Lovey's case, we got it right at that moment. So Lovey just bounced back like nothing.
Literally.
Yeah, exactly.
That's adorable. Oh my gosh. So, uh, also, I don't know for animals, but I know for people, a lot of times people get really anxious before surgery. So a lot of the work, the pre-work I do is helping people calm their anxiety. And as like, because a lot of the surgeries are less invasive than they used to be, and that's intentional. They've been working on this for years, like stenosis, which can be extremely painful. And if you think of the sacrum, and the sacrum is a bone at the base of the spine, has holes in it that the nerves come out through, right? And stenosis is when buildup of bone builds up, the osteoblasts build bone, and then they start squeezing the nerves, and that causes excruciating pain. And the surgery isn't that actually that big of a deal, but most people don't know that. And I've learned this from talking with my clients over the years. So they've told me. And I've also learned about recovery times, and I've learned about all different aspects of the surgeries by asking a lot of questions. So it's helpful for people and animals to work with somebody to give them support before the surgery, reduce those anxiety levels. You want to get those cortisol levels down. You're going to heal faster if your stress levels are lower for animals or people. And then you want people to feel like they're, and we want to have them focused on when we want to give them I give people meditations. It's basically self-hypnosis because I am also a hypnotherapist, and I give them self-hypnosis treatments for pain management and to visualize the accelerated healing of that tissue, and then to help them after the surgery focus on those meditations. And it does make a difference. They heal faster for sure.
Yes, yes.
Yeah.
And that's one of the benefits with me working with the pets is that I'm helping de-stress the pet parent.
Yes.
Because the
Right,
pet
and probably the
parent is
parent of the pet,
screaming. Huh?
the pet parent, the guardian.
The
Yes,
guardian, I am helping de-stress because they're, their baby's going in and they're all, nervous about it. And so that's where, right, I'm helping de-stress them because as we know, the animals will pick up on that and we want to help both of them on that surgery
and
day.
feel good,
Yeah.
right? Totally. Yep. So, um, oh, what did I want to say? So, and I'm just, it's one of those things where if you find out that you need to get it, you don't need to stress out, you don't need to freak out. You can call one of us and we can help you work your way through it. So,
Yes.
it's okay. You're gonna be okay. Just remember, let's talk about C-sections, okay? That's why millions of women don't die in childbirth. I would have died in childbirth if I hadn't been able to get a C-section. A lot of us, we just can't do natural birth. C-sections are important for a lot of women. So, I mean, that's an example of a surgery that is extremely important and helpful. So, try to reframe your thinking about surgeries. Try not to have a negative attitude about them. Try not to be fearful and try to look at how does this help? What does this accomplish? So that's important. And there are a lot of different kinds of surgeries out there, and a lot of them are done. I mean, eye surgeries are amazing. They get like robots in there, and there are a lot of robotic surgeries, but they do these things, and then people walk out, and then their vision is so much better. It's like amazing. So I want to remind people just to think about this in a positive way, and it could be a really good thing. So
Yes, because it's there to help you live your best life. And
yes.
so doing your due diligence will help your recovery and the whole process go much smoother.
So how can people do their due diligence, Vicky? What do you recommend?
Scheduling the pre-appointments with your energetic and
And
massage
host.
support people, as well as because you're already going to be doing the medical stuff.
Right.
That's the addition that can really make a big impact on the ease of the recovery because
Yep.
the medical field's not working with the energy and the energy body, and that's such a big part of our animals and us that, you need for the two to be supported. It's, the sweet spot for doing the
Yeah.
work.
So pre and post appointments, and it may
Yes.
be more than you realize. So you call your person. You also need to find out if they're available. So you should plan ahead, months ahead.
Yes. Because, right, good energy workers and body workers, we're full. I
We're
mean,
booked 2 months in advance, sometimes more. So
and so, yeah, I try to in my schedule to leave holes for emergencies and stuff, but even those
they
fill
book
up
up. Yep.
quickly. And so yes, the planning is the key, because that's what with Roxy and the dog that had both knees, we pre-booked. So we got her spot, she planned, and so yeah, Roxy is
She
running
have one of
around.
those, she have one of those little doggy carriages. I don't know what you call. They're like a little doggy wheelchair. They're like a little seat with little teeny wheels, and they put their little
Oh,
pink legs in it. I don't know what you call it. It's like a little doggy wheelchair almost, right?
yeah, 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 yeah. No, we didn't. She didn't do that. It
You
was
didn't
only
need that? Okay.
short term. No.
But they have those. And so and
Ew.
then if your dog needs that, the dog's back muscles are going to need to be massaged, because the dog's back has to work differently, because now it's a biped instead of a quadruped. And so, because, right, because the two
Right. And
legs aren't
then
moving. So now
that's
it's using its back differently, right?
yes. Yes. Well, absolutely. That's the same with getting one of their legs amputated, because their gait's going to be different. And so
Yes.
the whole body is functioning differently. And we want to keep
So
in balance. Yes.
absolutely. It's a big deal. I think what you'd said about like letting the animal know ahead of time, and then for people working with anxiety to lower that and all the preparation, and then when they get out, um, one of the things that's really key is take your meds, people. Don't do the oh, I don't like medication. Like, okay, in post-surgical recovery for human beings, medication's key to get the healing process to a certain point. Then you can stop taking your meds. But if you stop your medication too soon, some people never get better because they messed up their meds. It's true. I've massage clients that, because they stopped taking their meds too soon, they had ramifications with their bodies, and then the surgery didn't work out the way they wanted it to. And it's 5 days to 2 weeks for meds. It's not usually like a hugely long time. So, I mean, animals, I don't know what their situation is. You do, Vicki, but for human beings, like if they give you meds, take the meds for the full course of treatment.
Yes. And I recommend that with the animals
Yeah.
too.
Yeah. It's temporary.
It's temporary.
You're
Exactly.
not going to
They're
get
there for
addicted.
a reason, and it's temporary. If it was, yeah.
It's not going to get you addicted. And when you're
Right.
in high amounts of pain, you're not going to get addicted to that stuff, like because it's a short period of time and you're using it for a specific purpose. Now, and then if the doctor says as soon as you feel better, get off of it, then definitely get off of it as soon as possible. But just follow the recommendations, because in regarding pharmacology, the doctors do know what they're talking about. That's their scope of practice.
Yes, and the
Yeah.
medicine, just like the surgery, has its time and place, and that's the
Yes.
time to really lean into it.
Right.
Yeah.
Take it, and then when they say you can get off when you're ready, cool, do that. And then for those of you who need PT after surgery, do your PT. Some
Mhm.
people are recommended PT prior to surgery, and a lot of them don't do it, and then they have to get the surgery because they didn't do their PT. Sometimes people get surgery and need PT after, and if they don't do their PT, their physical therapy, the surgery doesn't work out. Like, don't be lazy, people. I love you, but I've had so many clients tell me what happened when they didn't do their physical therapy and the consequences of that. I want to pass that little bit of information from their experience to you to do your physical therapy. Just do it. Do they have doggy and kitty physical therapy?
Yes. Yes.
Really?
So like Roxy,
Oh,
she
wow.
did, they have this tank with a treadmill in it, and they add water. And so
It's a
she,
Hubbard tank, right? It's a Hubbard tank, isn't
I
it?
don't know what the official name, but anyway, so
That's my last name, but there's a Hubbard tank they use for physical therapy for people. I guess they have one for animals too.
yeah, so she's
Huh,
walking in the where the water is helping, well, helping give the resistance to help strengthen, and yeah,
that's awesome. Right
yeah.
on.
And that was where another of the communication needed to support Roxy because she was afraid of the noises it was making as they turned it on, turned it off, and she has to wait for the water to drain before she can get out. And she was a little
Wow.
nervous. And so in communicating with her and supporting her with understanding what that whole process was, then she could was more relaxed and able to do it.
That's awesome. I love it. I mean, I never would have thought of that. So you guys, remember with your animals, there are things that you don't even know that you don't know. So have them call Vicki or
Yes,
you and your friends call
exactly.
Vicki or whoever it is, just call Vicki. Uh, and just a reminder for Vicki's site, she has everything on her site. She has her books that you can see in her background. She has her lovely sprays that really work. If you are on the go with your animal, and you just need a quick energy shift, you can use one of your sprays with your animal. And then she has all of our prior episodes are up on her website under media. And you guys can take classes with her. So there's a lot you can do with Vicki.
Well, and there's a lot you can do with Ariel because, yes, as you can hear, Ariel is a font of information, and we both have many, many, many decades of experience. And so that's why we are committed here to educating you and helping you, like you said, from our clients that we have seen and from our experience, how we can, how you can ease your life.
Absolutely. And that's always our goal with this show is to make your life better.
Yes.
Yeah. Well, thank you everybody for joining us today. I hope you learned something great.
It's right. And it's self-love. I have to bring
Self-love
in the
is
month of love for February.
that's right.
So, well, then, like you said, but all is self-love. Doing the PT exercises, doing the
Yep.
pre and post work, doing it. And, it's
Planning ahead, lowering your anxiety through planning.
right. That is loving yourself and your
Absolutely.
body and then your pets.
And also
Um,
don't begrudge the money you're spending on this because if you have the attitude that you're spending on the money to take care of yourself or your pet, don't resent it because that resentment doesn't attract more abundance and prosperity. Gratitude does. So if you have
right.
the
And
attitude that when you're spending the money on this, it's to express that you love yourself or your animal and that you're grateful and appreciative of everyone who's helping, and you put out that energy of gratitude, you will receive that back and probably income to replace the money you're spending on the surgery too. That usually happens that way.
yes, exactly. And grateful that you even have it and have the option, you
Yeah.
know.
Yeah, we
Um,
didn't the options that we have today, people didn't have these 50 years ago. They didn't some of them didn't exist 20 years ago. It's pretty incredible, actually. It's
yeah.
amazing some of the things that are out there.
Yes.
Yeah. So,
So,
all right. Well,
it's
thank
been
you,
our
everybody. We
yes,
appreciate
it's been our joy being here.
and we'll see you next month, first Thursday of the month.
That's right. So remember arielhubbard.com and
Your animal.
healingyouranimal.com. And we would
Right.
love to hear how this has help you and your pets.
Awesome. Have a great day, everybody. Take care.
Bye.